Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
What's up, Wild Health family? Welcome back to another exciting episode of the Wild Health Podcast. I am Dr. Jeff Graham. I serve as the Chief Medical Officer at Wild Health and really love the episode theme for today because today we have one of my newest friends and partners with Wild Health. He's just been killing it for us, but we're joined by Dr. Danny Firth, and we're going to be talking a lot about the kind of transition from sick care to self-care that we like to preach a lot at Wild Health. Danny is a family medicine physician at Wild Health who's redefining what it means to help patients heal. After years of working in the hospital, Dr. Firth saw firsthand that our healthcare system often waits until people are sick to intervene. That experience sparked his passion for integrative and precision medicine, helping patients stay healthy and thrive instead of just recover. So today we're going to talk about how that shift took place in his own life and really how he balances being a doctor, teacher to his patients, a parent, and why he's a big believer in the benefits of some of the contrast therapy that seems to really be experiencing a moment right now in medicine. So Dr. Firth, welcome.
Thanks for having me, Jeff. I appreciate being here.
Yeah, man, I know you do. I've been excited about this one. We just had Damon Forbes, our other newest physician who's joined the team on. So we're trying to highlight you new big brains with our practice.
Yeah. No, I'm excited to be here. I think I've told you this offline, but I really appreciate having the opportunity to work with Wild Health.
Yeah.
I was a patient of these guys for 2.5 years before they took a chance on me and hired me part-time and then hired me full-time just a few months ago. And I can't explain to you guys how different my life is than it was when I was a full-time hospitalist.
Oh, that's great. Well, yeah, man, I want to dive into that with you, but why don't we go back a little bit further and tell us about your path up to this point? Kind of where did you start? Your education in general, and then what convinced you to pursue medicine and later on kind of integrative and more of a wellness spin?
Sure. So, I mean, the short story is I went to college because that's like what you're supposed to do. And, my mom, like, I remember I took some time off, like 6 months off before I went to undergrad, and my mom freaked out. She thought, oh, you're never going to go to college. And she was wrong. I went to school for a long time.
Yeah,
Uh,
you proved
but,
her
uh,
wrong.
but so basically I went to school, like, I think like a lot of people, like, cause that's what you do when you graduate high school, you go to college. And I just took a bunch of classes. I got to the point where one semester, I really didn't know what I wanted to do, and I needed 12 credits, so I took a bowling class just to get to full time. But anyway, total
Okay,
sidebar,
I took water polo one semester. It's the same thing. Yeah, yeah,
um, ultimately took a bunch of classes, thought I wanted to be a teacher, got as far as, like, going pretty far down that road, doing prereqs, looking into master's programs. And then through a bunch of different life experiences, like a lot of people in medicine, somebody gets sick, you get to shadow some docs and, kind of realize like doctors do a ton of teaching, right? Like if
yeah,
we're doing it right. I mean,
yeah,
unless you're, a pathologist or something, like you're
yeah.
talking to patients and hopefully teaching them something. So I kind of realized like, hey, this is a pretty good gig. You get to do teaching, you get to help people in a super direct way, and then I hurry up and did a bunch of prerequisite classes that were not part of the anthropology teaching path that I was on. And so I did that. I was at University of Florida and ultimately matched out in Arizona for my residency. So I applied kind of all over the place and looked at a ton of programs and really liked the Arizona folks just because they had a really strong kind of integrative medicine sort of bent to them, which was
Yeah.
important to me. I mean, I had a bunch of family friends who were chiropractors and, kind of more, different kind of practitioners than just
Non-traditional.
typical
Yeah.
Western medicine. And so
Yeah.
I just wanted to learn about that from people who were pretty good at it, right? So they had a great longitudinal program and, had some faculty who were super supportive, but they also were like a very strong traditional family medicine training program, right? So I,
Yeah.
I think I got kind of the best of both worlds
Yeah.
going down that road.
That's probably the most well-known, integrated fellowship that I know of, the Andrew Weil Fellowship that you guys had out there.
Yeah, they do a great job. And, I mean, I still go back and take some of their online classes because they have really, I mean, world-class people putting up stuff on their online curriculum.
Yeah.
Um, so yeah, they do a good job.
Yeah. He's been a big force in the integrative and kind of proactive medicine field for a long
Right.
time.
Yeah, I think he was ahead of his time,
He definitely was, he was involved in a lot of the early psychedelic research as well.
right. And,
Timothy
the
Leary
funny
and the
part is
others.
you talk to some of the faculty there, and they were like, Dr. Weil was just kinda like this quirky guy, and, he became this internationally known figure who,
Yeah.
like,
He
larger than life, but they were like, "Yeah, he's this quirky guy who was into these, like, kind of, weird things," and at least that's what everyone thought back then, right?
Yeah, yeah, turns out, look who's laughing now, right? Yeah. So, yeah, man, that's, to echo back to you, I mean, we feel super fortunate. Obviously, you did the Wild Health Fellowship. Eventually you became a patient and did that, and that's what put you on our radar. And, yeah, man, we feel equally fortunate to have you on our staff now. So, I got to witness as you were working part-time for us doing some contract work, but still had this every other week of, like, complete juxtaposition in the hospital. And I remember talking to you some, during that time, like, God, this is just so different. I'm admitting someone to the ICU one night, and then the next day, talking to a patient about their, the supplement stack that we have them on and why omega-3s are good for them or something. So, yeah, take us through a little bit about that. Like what you spent, I know you did some faculty work at a couple different places, including one of the Mayo clinics, and then transitioned into hospitalist work. Why did you make that choice? And then secondly, why did you make the choice to get out of there?
So, I I think I always had if you're anybody's like a Norman Rockwell fan, you remember like the paintings he did of like the old
Yeah.
school family doctor, like with everybody there. Like that was like my idea of what I thought being a family doc was going to look like.
Yeah.
And that was sort of like when I went down this road, like that was what I wanted to do. Take care of the whole family, preventative care, integrative care. But then, like there are life circumstances that sometimes change your mind for one reason or another. In my case, I married a wonderful lady who was a couple years behind me in med school. And so, for any of those you guys out there that are in the medical world, you know that you kind of go where you need to go for the training you want, right?
Yeah.
And my wife wanted to train with Mayo to become a neurologist because it's like world class training. And so I followed her there. And, I knew we weren't going to stay in Minnesota. It's freezing. I apologize to people who love cold weather, but like me and my wife, we like Florida.
Right.
And the winters were very long. So, like, I knew I wasn't gonna be there indefinitely. So, it didn't make a ton of sense for me to start doing primary care, right? And then knowing I'm gonna be leaving in 3 years.
Yeah.
So, we happen to have a super strong hospital program where I trained. It was, like, unopposed, which basically means we were the only show in town. There was no other residents there. So, we got
Yeah.
to do a lot, we got to see a lot, and I had a lot of good role models in the hospital world. So I decided, do I want to do urgent care? Do I want to do primary care and just leave like my patients in 2.5 years? And so I just decided to become a hospitalist and do that for the time we were up there, and then the same thing happened again, right? She did her fellowship somewhere in where I knew we weren't going to end up permanently for 2 years. So we were in
Yeah.
Gainesville for 2 years. and I was in the same boat. And so I decided, well, I've been doing this for 3 years. I'm pretty good at it. Like, let's just keep doing it. And then finally we had a chance to like decide where we wanted to be, right? She's finally done with training. We're getting older, like we have a kid. And like we're like, all right, we really like the Tampa Bay area. We're gonna move to Clearwater. We're both gonna take jobs. And I guess I could have worked in primary care, but I just like I talked to some of my colleagues who were doing primary care and like they were seeing, 30 patients a day or, something a lot. And
Yeah.
it just didn't seem like it was for me. So I decided to keep doing what I knew, right? Working in the hospital. But as more time went on and as we had more children, um,
That'll have an impact. Yeah.
yeah, like, and as I have with 3 boys now, a 7-year-old, a 5-year-old, and an 8-month-old. And as the 5-year-old and 7-year-old got older, like me not being there on the weekends and my wife and thankfully my mother-in-law like helping. Like, that was fine, but it was not great, right? Like, I wanted to, like, coach a soccer team and be there on the weekends. And the other thing playing into this is, the 7 on, 7 off lifestyle is, like, not great for your physical health.
No.
And I think there's just
Yeah.
no way around that, and we don't talk about that a lot in the hospital world, but, like, it's hard to work 7, 10 to 12-hour days in a row and have some kind of balance. So, I would talk with my health coach, Ray, um, who's been with Wild Health for a long time, I think.
Yeah.
Um,
Yeah.
and we'd always come up with these crazy schedules, like, how do I fit in, like, a little bit of, like, zone 2 on, like, the work weeks I'm working, and, like, can I get off early and make a deal with my partner so I can go to the gym?
Yeah.
And, so it was always this, like, balance, and then on my weeks off, I'd be a little tired and, like and so, like, I just didn't feel like I was like being the best version of myself for everybody. And I was
Yeah.
slowly getting burned out and just wanted to kind of, find a way to get back to really what I think my original calling was, right? Was like, how do I take care of people and keep them from getting sick?
Yeah.
I heard about Wild Health through a MCRIT podcast actually.
Yeah.
Uh,
Yeah. Scott
and
Weingart. Yeah.
yeah, Scott Weingart, yeah, so I heard about it through that and signed up as a patient and had a really good experience, and then I did the longitudinal, the curriculum you guys have, the precision medicine curriculum, and, and I made the decision that I was getting out of the hospital world one way or another, right?
Yeah.
So, I had some buddies that were doing telemedicine, and the advice that he gave me was, you just get licensed in all 50 states, and that'll make you, open up a lot of doors for you. And so I did that, and I started kind of looking into different options, and, did a little bit of supervisory work for some nurse practitioners, and then ultimately kind of started asking Ray and asking all the faculty for the the Wild Health curriculum, like, "Hey, you guys
Yeah.
hiring anybody?"
Yeah. Yeah. That it
But
made its
yeah,
way up to me eventually. That was
yeah,
yeah.
but
That
to
was
answer your original question, it was sorta like a Dr. Jekyll and Mr. Hyde kinda lifestyle for a
yeah.
while. So, like, it
Yeah.
would be I would see somebody at the end of a disease process, right? So, that could be for the most common one is, like, diabetes, right? So, I'd
Yeah.
get the 50-year-old coming in, with gangrene of his foot that, like, he had been ignoring for months because he had such bad diabetes and neuropathy and and then like, what do you do with that? Like, we're amputating prolonged
Yeah.
antibiotics. Like, we're
Yeah.
not like, I'm not really I mean, I'm helping this guy, but we could have helped him way more 5 years earlier when he had insulin resistance
Yeah.
without an elevated blood sugar, right?
Yeah.
Um, and so when I would come back to the Wild Health, the next week and talk to somebody about their fasting insulin level being 8 instead of 4, it was like, it almost felt comical in some ways
Yeah.
of
Yeah.
how, like,
Totally.
different it
I
was.
know. I know.
But, yeah, it really was getting back to where I wanted to be from the beginning, which was like, how do we prevent things and keep people healthy and
Yeah.
optimized?
Yeah. So you got to return to some of those teaching roots, it sounds like,
Right,
because that's a
right.
lot of what we do at Wild House is empower people to take control of their own health, and a lot of that comes through frequent monitoring and teaching about disease processes. So, was there a I mean, you just mentioned like a example of a diabetic with you know, a foot that needed to come off, or I'm sure you saw tons of renal failure from diabetes. And was there a moment at which, you just threw your hands up and said, "All right, this is the time."
I it makes a better story if there was, like, one moment where I was like, I was in the ICU and, like, this
Yeah.
mo
Yeah.
but it's kinda like my decision to get into medicine. It was, like, a bunch of little things that
Yeah.
slowly added up, and the other thing that played into it is I realized, like, the interactions I had with patients that I felt were, like, the most meaningful in the hospital were the people who were, like, wanted to change,
Yeah.
and, like, when I talked to them about, like, "Okay, what are we gonna do when you get out of here so that, you stay on top of this?" And they were, like they were bought in, like,
Mhm.
and they were willing to kinda like, "Okay, well, maybe we can do" and I would prescribe, like, tirzepatide and stuff, which is, like, not something a lot of hospitalists were doing, but, I would do things like that and talk to them about berberine for their insulin resistance, and, like, those started realizing, like, those were the most meaningful conversations to me, and, you know, keeping somebody from, going into a COPD exacerbation and getting intubated, like, okay, like, that's cool and helpful, but it, like, wasn't really bringing me much, like, joy or meaning
Yeah.
at that point.
Yeah. I think it kinda goes back, you mentioned the term that I feel like has become cliche, but it's very appropriate, and that's physician burnout. I had a friend, and there's been some rephrasing of that term, I know, in different articles I've read, that refers to it as moral injury for physicians. And I think that's maybe what I hear you saying, is that it's for us, selfishly, that's when we feel like alive in our practice, right? When someone's bought in and they're hearing what we're saying, and we're partnering with them to make a plan, as opposed to just, for me at least, when I was, because I had a brief career as a hospitalist, and it's just disheartening to know that you're putting on some Band-Aids, for a hatchet wound, and they're walking out, and they're gonna be back later, right?
Right.
Yeah.
Yeah, and they don't
So
yeah, I mean, you don't really think about that if you're not, like, in this world, but, like, the chronically ill patients are what keeps the hospitals mostly full,
yeah.
right?
Yeah.
So, these are, like, a lot of nursing home patients or, like, I call them, like, near nursing homes. They're like,
Yeah. Yeah. Close. Yeah.
and, they come in with very similar things, flare up of their chronic disease, and
Yeah.
yeah, it's yeah, like you said, it's kinda like putting a Band-Aid on it, and I just didn't feel like I was really helping these people,
Yeah.
and yeah, and the other part for me is that, I missed some kinda continuity. There were, like, the rare patients that were in the hospital so much, I felt like I was, like, their
Yeah.
primary care,
Yeah.
but I also, like, miss the fact that, now that I've been doing this for over a year now, like, I have patients I've been seeing for a year, and, like, you can see meaningful improvement in their life, but, in their blood work, like, in any kind of marker you wanna look at, and it's way more fulfilling to me than,
Yeah.
like, putting out fires.
Yeah. I love it. I love it, man. I think you're exactly right, and kinda serves both parties better, the patient and the provider, when you practice like what we're doing now. So yeah, talk a little bit about that. What does this approach that you bring to what we call precision medicine, but with your integrative medicine background, what is that? Are there certain things, and I'm just going to speak because we work in the same EMR, are there certain metrics that you're pulling up every time and looking at, or when you're preparing a note, going back and saying, okay, have we covered these things? Are there specific modalities that you're making sure you're introducing to every patient?
Sure. So, yeah, I mean, we obviously work for the same company, and we do a lot of the same blood work, so we're looking at a lot of the same things. I think one of the things that definitely sets us apart and what confuses patients a lot too is, we check a little bit more detailed blood work, or probably a lot more detailed blood work than a lot of people, and we specifically look at metabolic health, which is sort of like brushed aside in mainstream medicine until it becomes a disease, right?
Yeah.
So, and you don't care about uric acid until they get gout, or
Yeah.
and nobody cares about homocysteine unless you have some kind of weird genetic thing and you end up in like a I don't know, a geneticist's office or something.
Yeah.
But like, so there's certain labs we check, like for, I named a few, but like I think the ones that really stick out for me that I track pretty much on everybody is insulin levels in addition to the traditional markers, hemoglobin A1C, fasting blood sugar. I think homocysteine is another one that like I had no idea about the literature behind this, right? Like that high homocysteine, you know, is associated with excess risk for cardiovascular disease, so strokes, heart attacks. The studies on it are like quite clear if you look at especially at the extremes, right? So people with homocysteine above 15, above 11, like it's very clear that makes your risk for stroke and heart attack go up. Somewhere, if I remember right, it's like 60% at the higher levels and maybe 20 or 30% at the lower levels. But it seems to be a linear relationship. So what we do is we look at a lot of those markers and we say, hey, these relationships seem to be linear, right? So like the highest quartile or quintile or however the study was had the highest risk for bad things. And if you look at it, the lowest quartile, quintile, however the study was done, seemed to have the lowest risk. And so what we do is we just have our reference ranges much tighter than the traditional LabCorp ones. And so, we'll check the homocysteine, for example, and we try to get that down, basically as low as we can. And, and there's different ways you can do that, right? There's a lot of low hanging fruit. We work on, simple things like making sure their B vitamins are good, making sure that they're eating enough choline.
Choline.
And
Yeah.
the fun part that we do is we have more information than average, right? So we have their genetics. So
Yep.
I can look at somebody's homocysteine and say, is it still stuck at 9 because I haven't got your B12 level to 1,000? Or because, you need to eat a lot more eggs, which have a ton
Mhm.
of choline in them. And it's a much more interesting way and a much more precise way to practice. And, that goes, we could talk about the same thing for insulin levels, right? So like somebody that has high insulin resistance, um, you can look at their genetics and see if they have a bunch of FTO genes, for example,
Mhm.
and you can sort of play into that. So the way I've thought about it, especially for like the insulin resistant ones, is the more you have genetics going against you, the the more we have to either push on the diet and lifestyle things if the patient that's the direction they want to go, or you have to help them along with supplements or medications, right?
Yeah.
But I think it just reframes the conversation in a way that's like much more fruitful for the patient. Like that way, because and we go over this with lipids all the time with patients. Like some patients are just like, I don't want to ever, take a medication. I just want to eat more fiber and cut out my saturated fat. And you show them their genetics and you're like, how long do you want to bang your head up against the wall?
Yeah.
You're not
Yeah.
gonna get there with diet and lifestyle. Like we
Yeah.
gotta do something different.
Yeah. Yeah. No, I think that's beautifully stated, man. And you actually used the word precise when you were just describing that. So I think you're describing precision medicine to a T, using genetics and epigenetics and these different labs that I think are better at catching these disease states earlier. And I love something you said too, metabolic health, that we don't recognize as a risk factor until it's a disease, until it has an ICD-10 code. And you're exactly right there, because we know the truth about diabetes is that dysfunction is starting usually 10 years before we're seeing, "Oh, look, your
Right,
glucose popped over 100. We need to pay attention to this now,"
right.
So, yeah.
Yeah. No,
Yeah,
for sure, it's like it's a kind of medicine, frankly, I wish I knew about over a decade ago when I
I
started
know.
doing this
I
because
know, man.
I mean, I think about family members, like my
Yeah,
stepfather.
yeah,
I'm sure he was pre-diabetic or insulin resistant, maybe not even pre-diabetic for a super long time. And, just nobody picked up on it,
yeah,
then he gets triple vessel disease, has to eat a cabbage. And it's just like it's a road that if he knew about it a decade, maybe 2 decades earlier, like
yeah,
things could have turned out much different,
yeah.
right?
100%, man, 100%. Preach it. Preach it, Danny. Yeah. Okay, well, cool. That's good, man. So, you've taught, you've led departments. I know in the hospital, we were talking about you were good enough to just rewrite our physician onboarding protocol, basically because when I onboarded you, you were like, "We could do better at this." I was like, "Yes, we could. Thank you, Danny." So we're working on that. You're really good, I think, with protocols and kind of picking out, poking holes in things, what I think is really important. How are you finding a kind of reflecting back on your own health? You've made this decision to get out of the hospital. The protocol for taking care of Danny Firth right now. How are you doing that with 3 kids, all under 7? A wife who's a neurologist, and trying to practice what we preach at Wild Health. What are your non-negotiable habits? You're like, "I gotta do these things."
So, I that's a really good question. I think that even when I was a hospitalist, I made it like my health a priority, right? Because I think it's super easy to like play this game where like, oh, I'm too busy to do this. Like I've got too many responsibilities. I got to take care of my kids. And, like I think if you sit down on the edge of your bed and like are very honest with yourself, if you're not taking care of yourself, like, you can't take care of other people. Like,
Yeah.
it's just the way it is. Like, you won't have the energy, physical energy, emotional energy, however you wanna think about it. So, like, I think that's, like, the first thing. It's like, even when I was a hospitalist and I was kinda burned out, I still found ways to, like, fit stuff in, and it wasn't ideal by any means, but, like, I was still fitting in my zone 2. I was still doing some intervals. I was still doing resistance. I think the diet, like, that we won't talk about that. I mean, the
Yeah.
stress, like, um,
Hospital food, man. I know. I know. It's
um,
ironic.
moving forward to where we are now, and it's only been 3 months since I've been full time, so, like, I'm still, like, getting used to, like, my newfound lifestyle. But, I really do try to practice what I preach to patients. So what that means for me is like, I think most of us think in sort of buckets, right? You think in
Yeah.
like, resistance train bucket, zone 2, which, for those of you that like aren't really into the whole zone 2 thing, it's the slower cardio. You can still hold a conversation. Your heart rate's maybe 70% max heart rate plus or minus. Um, so it's the resistance training, zone 2, and then interval training. And then the part that, like, is a work in progress is, like, the stability yoga part,
Yeah.
that I'm still kind of working on.
Yeah.
But what that looks like day to day for me is after I'm getting my kids ready, taking to school, I'm going for a run or I'm getting on the stationary bike.
Yeah.
And, that's 4 or 5 days a week of some combination of zone 2, or an interval or zone 2 followed by an interval. And then I'm going to the gym or doing a garage, workout twice a week. And those are, I mean, essentially just sort of baked into my life
Yeah.
now, unless I get injured, which I did last month. Um, Slows you down a little bit.
You talk
That's a
to your
whole
health.
nother conversation of like, how do you exercise safely when you're in your 40s, 50s, and 60s?
Yeah. Yeah.
Getting injured will take you out of the game.
Yeah, totally, totally. So, I mean, and so I hear that about your physical health. I'm interested too. I know you and I recently attended a work offsite, and we always, as a group, I love this about our group. It's part of our culture. Just our ethos is like doing breath work together and really, breaking down. I feel like it's energizing. It starts the ideas popping, gets the brain running early in the day, but it also often brings some, some tears and some real
Right.
vulnerability, and we get to really share openly. So I wonder about that, how kind of that how you treat that mind body connection with your background in integrative medicine and where you see that playing a big part in your own life.
Right. So I think the first thing is when you get busy, that is for me personally, and for probably a lot of people, like that's the first thing that kind of gets kicked aside. Like
Yep.
I can't wake up an extra 30 minutes early and meditate and journal and do my breath work. Um,
But
but
it's
what
also
I have
probably the most important time to do it.
Right, right.
Yeah.
And so that's what I've noticed is
Yeah.
like the times that I've made that decision, which is usually an unconscious decision. It's not like I woke up one day, I'm like, I'm not going to do this." Um, but what I have noticed is that I will slowly start not feeling as good. And I've noticed that if I can, somehow find a way, and even, maybe if I had the baby was awake and I didn't sleep and I had to skip it that morning, that if I can find something to do, even if it's only going for like a mindful walk,
Yeah.
which like was kind of like an epiphany to me when I read that little How to Walk book by I'm gonna butcher his name, Nat Tuck Khan or something.
Take
He's
Nhat
a
Hanh?
Tibetan guy. Yeah,
Yeah. Yeah.
yeah.
Thai.
Um,
Yeah. Yeah.
um,
He's
but
amazing.
that was like that is a really cool hack for like if you are very averse to sitting and meditating, which like I know a ton of people are, but just mindfully walking. And all you do is either you pick one sensation to pay attention to. So it can be your feet touching the ground, or it can be, this is another weird one that I never thought about. The wind
Mm.
going past your arms as you walk, like if you really pay attention, or your breath, whatever does it for you. But like I
Yeah.
noticed that's like a little hack. If I get behind on my morning meditations, like that'll help bring me back. Um, But, like, in an ideal world and what I try to do, at least 4 or 5 days a week, doesn't all is wake up at least 30 minutes early, do some stretching, like I was mentioning earlier, like,
Yeah.
I'm working on thoracic mobility.
Yeah.
It's a big one for me.
Yeah.
Do some journaling, which and then, and then do some meditating.
Yeah.
The breath work you mentioned that we did on our retreat was really blew my mind. I think
Yeah.
you've done it before, so it was kinda like, I mean, I'm sure it's still cool for you every time, but it wasn't like, "Holy shit, like, what the hell happened?"
Yeah.
Um,
Yeah.
but that was really cool. I didn't know by doing prolonged breath work how much you could change your state, and
Yeah.
that was wild.
Yeah.
Um,
Yeah.
it was
It's
really
pretty
wild.
amazing. We try and get in the holotropic space a little bit. You actually have kind of an out of body experience for a lot of people, and yeah, similar to, to psychedelic medicine in a lot of regards. But yeah, we just did that again at the retreat we just had up in Bend, Oregon, which I'm going to plug at the end of this podcast for our listeners. We're planning the next one already, and we'll be inviting anyone who can come. But it was really, I think, mind blowing for a lot of our clients, our patients who came to see the effect of that, like you said, who had never done it. So another
Great.
thing that I know you've been digging a little bit on recently, because you presented to our physician group at a recent physician meeting, is some contrast therapy stuff. And I know we specifically talked a lot about cold plunge, but I wonder, after taking a bit of a deep dive on that recent literature, if you have any updated recommendations. I know I learned some stuff where the evidence really stands with that. Kind of surprised me some, because I thought some of the benefit I was getting when I do it was maybe more pronounced than what the literature's saying. So walk us through a little bit of that.
Yeah, so, everybody should do cold plunge every day. No, so case closed. No, so, yeah, what I had, full disclosure, I was like a Wim Hof, like, fan, started, I read his stuff, listened to him, did the Wim Hof breathing, and I really had kinda, like, drank the Kool-Aid early on. Um, but then, I finally went and bought a cold plunge instead of just doing cold showers or putting ice cubes in my bathtub, which is really annoying. And, um, so I finally bought one and I listened to some more podcasts, listened to the Huberman podcast with, Dr. Soberg,
Yeah.
and then, just started really thinking about like, what am I doing? Like, and how long do I need to be in here? How frequent do I need to do this? And then what are the benefits? Like, how much am I going to get out of this? And so I did a deep dive, gave a little talk, kind of internal talk to the crew here at Wild Health. And, the part that surprised me the most is that the evidence for some of the benefits that a lot of people talk about is not as overwhelming as I thought.
Yeah.
So there's definitely benefits, like, don't get me wrong, like, there's definitely benefits, but if you have a finite amount of time or a finite amount of resources, I would do sauna,
Mm.
right?
Yeah. That
I
was kind
think
of my takeaway too from what you were saying.
yeah, but if you have but the thing is, like, you can do cold plunge in a relatively short amount of time and on a relatively, you know, reasonable budget. I mean, the ice one is like, you gotta buy the ice, but you can buy a chiller and a tank for about $1,000,
Yeah.
so it's not like crazy. But if you had to make a choice between the two, I think the evidence for sauna for dementia risk reduction, for cardiovascular risk reduction is just ridiculous. 50, 60% reduction of like horrible things.
Yeah.
But that's a sidebar. But going back to the cold plunge, like, what do we know for sure? Um, we know for sure it will help with muscle soreness. So like your high school, track coach was right.
Yeah.
Putting in your legs
Yeah.
in the cold, freezing cold bucket of ice like that helped you. So like we know that. There's a caveat with that though, right? So like if you're trying to work on muscle hypertrophy, muscle strength, if you go to the gym, do a hard resistance training, and then jump right in the cold plunge, you are going to mitigate some of those gains.
Yeah.
And there are multiple studies showing that. So the ones that I came across, they got some college age men to volunteer to muscle biopsy of I think their vastus medialis. Like, I don't know how
Big,
they did that,
big quad.
but
Yeah. Yeah.
yeah, but your quad.
Yeah.
So they proved that there was certain cell types, I believe it was satellite cells and a couple other fancy ways that basically they put one leg in the cold plunge, one leg out of the cold plunge, and they had them do, a bunch of squats and leg exercises before. And they showed pretty unequivocally, like, you blunted the response. You still got a response, but you blunted the response. And they did this study. It was like a 10 or 12-week study. It was pretty well done. So there was that one. Um, there was another one where they did a tracer where people drank a protein supplement that was
Yeah.
had a tracer attached to it. And that was quite clear. If they had one leg in the cold water, one leg out, that more of the trace protein went to the leg that was not freezing cold.
Yeah.
So, you and I were talking about this and, I've heard some other folks, I think Peter Tia talked about this too, is like, is there a sweet spot, right? Like, could you do a hard workout in the morning and then in the afternoon do a cold plunge 6 hours later and get the best of both worlds? And the answer is like, probably, but we
Probably.
don't know for
Yeah.
sure.
Yeah.
So definitely don't do it in the first couple of hours, but, and it's not like you're gonna not get gains, you're just not gonna get the same as you would. So if, like, preventing muscle soreness is super important to you, then, like, by all means, like, go for it. So that was interesting in the quality of that evidence was, like, super high.
Yeah.
So, like, we know those 2 things I just talked about, we know those, like, very well, like, pretty certain that those are both true. The ones that a lot of people talk about that I came away with, like, maybe not being quite as, like, gung ho, like telling patients like, yes, this is definitely going to work,
Yeah.
is immune system. So I used to think like, taking cold showers every day or cold plunge every day was going to activate my innate immune system and like I was just never going to get sick. Um, and the evidence for that is not nearly as strong.
Yeah.
So that was one thing that I thought was interesting. The other one that actually does have some benefit, but there's like a lot of people that take issue with this because there's no way to placebo cold plunge is a mood.
Yeah.
So a lot of people notice that they just feel better.
Yeah.
And like, we have like they've done blood draws on people after being in cold plunge for 15 minutes and your levels of dopamine go up 250%. So like, there's like biochemical plausibility. And then I think there's a ton of anecdotal evidence where like people are like, yeah, I just feel better when I go in the
Yeah.
cold plunge.
Yeah. Yeah.
So I don't know what your take on that is. Like if
Yeah,
you,
that was to me the most shocking thing you came back with, and I think I had just believed the Andrew Huberman tagline about, "Oh, it raises these levels for 6 hours after," and he's a scientist, right? He's a PhD, and so he's gonna look at those levels and say, "Yeah, it must help mood," but what I took away is that what you found is that when they asked people to report about their mood and did it actually improve substantially over time, that there wasn't as clear a correlation. Is that
yeah,
correct?
it seemed to
Yeah.
be a little bit in the right direction, but it wasn't like overwhelming. And,
Yeah.
you always have to be careful at like oversimplifying the human body, right?
Yeah.
Like, oh, look, dopamine levels went up. Therefore, people are happier. Like, well,
Dopamine's got a lot of other responsibilities other than being our, kind of our reward,
and then
hormone.
one that I think I'm hoping we get some more data on, and, this, I mentioned her earlier, but Susanna Soberg, hopefully I'm not butchering her name, um, is doing a ton of research on the metabolic effects of cold.
Yeah,
And I think this is an area that is going to be really cool. She did a study where she compared cold weather swimmers. So these are people who live in Copenhagen and they had been jumping in, whatever freezing cold river or body of water they have outside of Copenhagen for at least 1 year. And then she compared those to people who were like age matched, BMI matched, and, roughly did about the same amount of exercise, and she looked at their metabolism. And what was interesting about that group is that they process glucose much better.
yeah,
So 2-hour glucose tolerance test, they cleared out that glucose much faster. The other thing that was super interesting is they had less visceral fat. But the rub with this, and she comes right out and says this in the limitations part of her study, is that they thought they matched these people really carefully, but when they DEXA scanned them, their, body fat percent was dramatically different. It was
mm,
like, I think the controls had, like, 6% higher body fat, so it
mm,
was more like 14% body fat in the winter swimmers,
mm,
don't quote me exactly, and, like, 20% in the controls, even though they had the same BMI. So, like, that's a
yeah,
kind of a plug for getting a DEXA scan.
yeah,
Um,
yeah,
but so the question that she has and that I have is like, was that because they were swimming in the cold water, or they just happened to pick 8 people who were just, like, super lean? And,
yeah,
that's and I think that's, like, an open question, but there's probably some metabolic benefits, like,
yeah,
'cause, but those are it's not like you're gonna burn, like, hundreds of calories from your brown fat. You
yeah,
might burn, like, a little bit extra calories a day,
yeah,
and it seems to improve, insulin sensitivity a bit.
yeah. And then one thing that I usually advise patients on if I'm looking at their kind of their mitochondrial density genes, like the PCG1 alpha, if they've got a couple of wrist snips around that, I do tend to say, hey, from what we understand about cold plunge, it probably is going to help build up some of your mitochondrial density, might help have some offsetting effects for your metabolic health. So I think that that can be super insightful about what we do at Wild Health. But yeah, so yeah, it was all fascinating to me. I think for me, it was the mood thing as much as anything. I really did. And I think there's a part of that. I just wonder what your thoughts on this. I mean, there's just a part of the human experience. If you think about any time you've ever been scared or stressed, you walk around a corner and there's a bear or something. You get this immediate catecholamine release and all this big stress response. And it's kind of this, and then you walk away and we have that post endorphin rush. It's that kind of, I call it like the oh shit response, right? Like, oh, I'm still alive. So for me, that's what, you get in some really cold water and stay in there for a little bit and you get out and it's like this overwhelming gratitude. Oh, I'm okay. Everything's all right. I think
Yeah, no, that's an interesting way to think about it, and yeah, we didn't talk about the norepinephrine release, but I if I remember right, it was like an outrageous percentage, like
yeah,
10,000% above your
yeah,
baseline level of
yeah,
norepinephrine or something. It was a crazy jump in that as opposed to the
yeah.
250% for dopamine.
And I'll tell
Uh,
you something I talk to my patients about because I've experienced it myself, and I need to look at the literature and see if there's a clear correlation here yet. But when I'm looking at my like improving my HRV, that's one of my obviously sleep, hugely important, appropriate recovery. But that if I had done a cold plunge the day before and practiced some slow breathing, like a, box breathing set throughout the time I'm in there, where you're just breathing 4 times a minute, that really my HRV goes through the roof. It really helps boost
Interesting.
that.
I'll have to start paying attention to that the mornings after when I look at my
Yeah.
HR. So
Yes,
you do box breathing while you're
in the
in the
cold
cold
plunge.
plunge?
Yeah. Yeah.
Yeah.
Something
I
like
think that's it. That's an interesting thing. What do people do when they're in the cold plunge? Like,
yeah.
I
Well,
think there's like, one thing you can do is you can just suffer, right? And think
yes.
about how cold it is,
That's
and I've realized that is the worst
It's
strategy.
the worst strategy. That's what I mean. So, yeah, I think you in your talk, you were going back and forth. You showed us this sympathetic, parasympathetic kind of drive loop that happens. And for me, I don't think I even said this, but I was like, oh, that's what I'm trying to do. Actually, you get in this massive sympathetic response, fight or flight.
How do you bring that down? Yeah.
Yeah, and being able to all of a sudden override that with your breath, which is about the only system that we have available to us that can override
Right.
that.
No, I think that's great. I have not gone down that road. I tend to use it as a time to practice mindfulness
Yeah,
because you think about it's very easy to say, "Oh, this water is freezing cold, therefore I'm suffering."
yeah,
But you don't have to make that leap. You can just
yeah,
notice how cold it is and you can even go as far as like, "Well, are my fingers colder than my toes?" And it's like
yeah.
it's kinda like interesting, like, little study of yourself, and you don't
Yeah,
have to
yeah,
make that
totally. I
you don't have to
think
make
for
that jump.
me yeah, for me, that's where because sometimes I don't have that state of mind to get into accessible, so I just start counting, inhale 1, 2, 3, 4, hold 1, 2 yeah, and all of a sudden, I've done that 8 times, I'm like, "Okay, I've been in here 2 minutes, that's great."
Interesting.
So,
Yeah,
yeah.
I'll have to test that one out, and,
Yeah,
maybe I'll keep my watch on so I can see what my heart rate does.
yeah,
I do some
totally.
box breathing while I'm in there.
Totally, totally. And then the other thing you already mentioned, the overwhelming benefits we know that come from sauna. I think something interesting to bring up that one of our other physicians talked about is that a lot of that literature comes from these Scandinavian countries where they have demonstrated massive reductions in Alzheimer's and coronary artery disease. And but we also know that the practice a lot of times in those countries is a contrast practice, right? Where you're doing extended session in the sauna, and then usually that's interrupted by cold exposure, and then you're back in there. So seems like maybe we settled on that not being exactly clear. Is it actually sauna or is it this contrast thing that is
Yeah, I think that's gonna be hard to tease out. I mean, what I f found interesting, and I think I'm glad that I had some fellow anthropology nerds
yeah.
that said,
You, me, and Damon, right? Seems like it's
yeah,
a
I
pretty
looked back
yeah.
at the history of this stuff, and contrast therapy has always been the norm,
Yeah.
right? So you look back in antiquity to Greeks and Romans, they were I don't know how they jerry-rigged all this stuff, but they did. They were pretty smart people. But it was always sauna and then cold plunge. I'm sure, you know, they couldn't do it in the summer, obviously,
Yeah.
but they would do both. And what Damon said, one of the other Wild Health docs, is that like you mentioned, it's kind of part of the culture to do both. And
Yeah.
even in that Soberg study I was mentioning, all the people that were the winter swimmers also did sauna. So,
Mm.
like, how do you tease
How do
out
you
the
tease that
metabolic
out?
benefits of
Yep.
that if all 8 of them were also doing sauna?
Yeah.
So, like, my take home message on this is, like, if you can do both, like, do both, right? And they're, like a lot of things, um, there's a time commitment, right? But what I can tell you about sauna and cold plunge is that with few rare exceptions that, we talked about previously, like there's certain people who probably shouldn't do cold plunge. Like if you have predisposed to heart arrhythmias or like you're, super young or super old, like you probably need to be careful and talk to your doctor before you do it. But that, barring those rare cases, there's like no side effects, right?
Yeah.
So this even compared to like an herbal supplement, like there's still occasionally people that have some weird stuff happen. And especially compared to, some kind of pharmacology, they always had side effects. But this one, there is no side effect,
Yeah.
right? And so there's all benefit. And it's
Yeah.
mainly just your time and, probably potentially some money, right? If
Yeah.
you're gonna buy these things or go
Yeah.
somewhere and do it.
Yeah. But I can man, I'll put in a personal plug. The 2 of the best investments I've made over the last 5 years have been installing a sauna in my house and, the combination of cold plunge and an 8 sleep mattress that keeps my bed cool. Because it is for the first time in my life, I never realized how bad I was sleeping in hotels, and
Oh,
then
yeah.
you get that, and that's my nighttime magic, 15 to 20 minutes of sauna followed by a cold plunge. I sleep as well as I've slept in years after that combo.
Yeah, I wonder if you're an outlier with that one. We'd have to do some more
I
polling to
know,
see
you
how
called
many
me on that. You're like,
yeah,
"Before bed? What are you talking about,
I
man?"
know.
Yeah. Yeah.
But, yeah, we'll have to poll some more people to see how many people sleep well after, cold plunge,
Yeah. Well, we
but it
talked
does
about,
make
it makes
sense, right?
sense. Yeah. In the
It does
fact
make
you
sense.
want to lower your body temperature
Right.
before you
Yeah,
get,
I'm not arguing with that, I'm just
yeah.
arguing with, like, the catecholamine release that
Yeah.
a lot of people get a little fired up after that,
I know, I know. Well, it
but
feels so
but yeah,
good to get out of that cold and then put some socks on and, crawl under the covers and read for a little bit. Yeah, just it's something. You're probably right. It's probably an individual response, different to each person.
right.
But
Yeah, and that and that goes back to, like, this whole way that I think a lot of us in this space think about it, is this really is like an N of 1 experiment,
yeah,
right? So
for sure.
so, and and that's how I try to frame things when
Yep,
I'm talking to patients is like,
yep,
"Hey, let's do this for a month or 2 months and, or a week or whatever and see how you feel." And, yeah, and everybody's responds a little different. Everybody's got different genetics. So, like, I agree. Like, I
yeah.
think
And I
don't be
think,
afraid to self-experiment.
yeah, 100%. And I think because it's such individualized care that we try and provide with our patients, like you're saying, I think one other thing that we need to do a whole nother podcast on are the benefits of sleep. I've been doing a deep dive on neurodegenerative disease with the relationship with GLP-1s there. I've been just coming across a lot of literature out that. I mean, you know, despite all this cool stuff we're seeing with some peptides and the potential to reduce Alzheimer's over time, it's still not as powerful as just sleeping well consistently. So for me, like that's the recipe I've built for myself. I know if I can do those two things before I go to bed, even if I'm not getting huge benefit from sauna or cold plunge, the fact that I'm sleeping well for 8 hours is like irreplaceable. So yeah, so I think
I
yeah,
agree. I finished listening to Matt Walker's book about why we sleep, where he just beats you over the head for almost 300 pages
I
of
know.
like how slow sleep is. It's like, all right, I get it.
I
I'm gonna
get
do
it.
it.
I'm gonna sleep. I'm gonna try and sleep. I know. I know. Well, from an anthropologic view, the most interesting thing, we'll have to tie this up soon, but just to say one or two more things about sleep, since you're an anthropologist and a lover of that stuff. I love the whole idea behind the evolution of our species about there's virtually no evolutionary benefit to us being asleep for a third of every 24 hours, right?
Mhm.
We're more vulnerable to predation. We're not fueling the fires of whatever we, need to be. Not we're not gathering things during that time. We're losing time to be able to provide for ourselves. So that's what's fascinating to me about sleep, and I think Matt Walker talks about that a lot too.
Right.
Just like,
Yeah. No, he for sure does. And yeah, and I think a lot of people try to kid themselves that they can get by and it's I mean, you can get by and you can survive, but you definitely are not thriving. And I was thinking about this lately as I've switched to doing this kind of medicine where I have a lot more control over my schedule, where I don't have to wake up at 5:30 in the morning. And I thought sleeping 6.5 hours was like fine. Um, but I didn't realize that I just felt, like, a little bit bad all the time,
yeah,
and I already thought that was normal. It's sorta like the boiling a frog kinda thing,
yeah,
you're
exactly.
failing to notice it,
Yeah,
and so, now that I have a bit more control, if I don't have to wake up super early, which is, like, rare, um, or if I happen to if I get to bed early enough, like, I will sleep 8 hours, like, no problem, and
yeah.
if I do that for a few nights in a row, I start feeling
You
dramatically
feel
better, and
incredible.
so you just
Yeah,
yeah, and so you just realize, like, I think a lot of people just get so used to feeling a little bit bad that they don't know how good they could feel if they had, a long string of good night's sleep.
totally. I agree 100%. Alright, man, well, let's start to wrap this thing up. What are If you had we've talked about exercise, so that's off the table. What are 3, like, non-negotiable habits or lifestyle hacks you might advise people to, "Hey, if you don't know this, find this out," or if you're not doing this, at least start to consider making some time for it?
I feel like I'm gonna say sleep just because we just talked about it.
Well, that's okay. That's okay. I mean, I mean, I think one thing, I mean, just let me give you a little nudge here. I know one thing we talked about at Wild Health a lot is, what we measure, we modify. And I think that word is still not out there enough. So I'll give you a little softball pitch. That one of the things that I'm surprised still when I talk to patients, I'll be 15 minutes into a conversation and ask what their blood sugar readings are throughout the day. Well, I don't know. I'm like, oh, well, we need to send you a continuous glucose monitor. There's like some things like that, yeah, that I think about.
Yeah. I mean, I I'm gonna throw one in there that is maybe a little more hard to measure, but I think it's important is, like, social connections, right?
Yeah.
So
Yeah.
so, I have a couple of patients and one family member that I think about where, like, we know, like, loneliness is a risk factor
Mhm.
for many diseases, like
Mhm.
cardiovascular disease.
Mhm.
So I know that's,
Dementia.
this is
Mhm.
thing yeah, dementia, cardiovascular disease, like, and, the numbers, I can't think of off the top of my head, but they were much higher than I thought they would be in terms of how much it increases your risk. But, like, so I think social connection is something that, doesn't get it's not as sexy, right? It
Yeah.
doesn't get as much press as, like, wearing a CGM and wearing an Oura ring
Yeah.
and getting your homocysteine level checked. But I think that is one that should be a non-negotiable.
Yeah.
And if you have a family, you're sort of like it's there by default. If you don't have a family, you have to go out and kind of make sure you're putting in the time and effort, not just to your career, but to like making some connections with people and
Yeah.
having hopefully some meaningful connections.
Yeah.
So I think that's kind of an important non-negotiable.
I think that's
And the other one
sad.
is
Yeah.
the other one I'll pick, in addition to sleep is like exercise.
Yeah.
I'm going to leave diet out because I think I, I think as long as if you're exercising, then your diet will probably not be terrible.
Yeah.
I mean, it might not be ideal,
No, that's
but
true.
I
Yeah.
think if you're putting in enough time and like effort into exercising, you're not gonna like go eat a whole cheesecake afterwards.
Yeah.
Um, and the advice that we talk about, and I'm sure you'd see, is that you meet people where they're at, right? And like part of my job, I think, is like a motivational interviewer.
Yeah.
Like, you get people to kind of think about like, well, if, you know, 3 months from now, you could, walk up those flight of stairs without getting short of breath, like, how would that change your life?
Yeah.
And you start to you kind of ask questions, get them thinking about into the future. And, these are things that like I knew about, but I didn't learn about sort of how to operationalize those questions till I met with the health coaches,
Yeah.
when I was in the curriculum, and they kind of got me thinking about that. But yeah, to kind of tie together, I think you meet people like for exercise, definitely non-negotiable. And the best kind of exercise that you can do is the one that you will do.
Yeah.
And that's what you should start with. And, there's an ideal world where like you do 4 hours of zone two and at
Yeah.
least two resistance training and at least one or two intervals. But like, no, like that's not like you don't
You
start there,
Yeah.
right? You start with where you are and what you have time to and what you're willing to do.
Yeah. I love it, man. So well said. Well, Danny, it's been awesome having you today, man. Hopefully people feel like they got to know you as a person and provider a little bit better and got to learn some about contrast therapy and some of your own life hacks that I think are leading to a lot of success in your life. So thanks for joining us.
Yeah, thanks for having me.
Yeah, dude, always. We'll have you back. We're trying to get some of our providers on here more regularly so everybody can feel comfortable with their Wild Health family. One more shameless plug that I mentioned earlier. We are planning a retreat for next fall, probably in late September or early October. We'll be sending out some information on that soon. Would love for our patients to attend. It's going to be full of education. We're going to do sauna and cold plunge like we just talked about, like we did this year. Some exercise sessions with our health coaches who are really trained professionals and can walk you through a lot of that and teach you about some zone training that Dr. Firth was mentioning today. So Hope you guys have enjoyed this most recent episode of the Wild Health Podcast. Danny, thanks again, man.
All right. Thank you. Bye-bye.
Yeah, man. We'll see everybody soon.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.